Hi, you guys. Welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review books, review videos, and one on one sessions to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, I like to get into my disclaimer reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the guidelines that are currently being tested on the ANCC as well as AAMP exam. Now, any of the videos that I do that I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into our questions for today, y'all. One quick insert as this is quickly approaching. We have our upcoming practice question course on July the 13th. We are 1 week away. It is from 10 a.m. to 11:30 a.m. Eastern Standard Time, and that would be 9 to 10:30 a.m. Central Standard Time. If you're looking to join, it's only $49. I will work through the exam breakdown with you guys so that you understand with each exam, family and adult GERO, what to expect, the percentages of each, the number of questions for the ANCC as well as AAMP exam. We'll also work through practice questions live through each system area. I'll tell you how to answer each question type, provide you with test taking tips, and we'll also have a Q&A session so that you're able to get your questions answered live. If you're looking to join us, I have 2 available spaces that will be linked in the description of this video, okay? Also, I have some exciting news that one of my past review students from 7 years ago reached out and donated and purchased a course for someone. So I will be letting you guys know who that person is on tomorrow. Okay. All right. Let's get into our questions for today. All right. Question number 1. An African American patient presents to the office today for follow up. The patient denies any complaints at this time. Vital signs are as follows: blood pressure is 140/92, respiration is 20, pulse is 78 beats per minute, and the temp is 98.8 degrees. He does not currently take any medication. The nurse practitioner is reviewing the patient's lab and notes that potassium is 2.3, sodium is 136, and glucose is 98. Based on these findings, how should the nurse practitioner treat? Is it A, chlorothalidone, B, lisinopril, C, amlodipine, or D, losartan? Take a moment and tell me what you got in the comments, you guys. All right, you guys. So here, stem of the question states, based on these findings, how should the nurse practitioner treat? I always recommend reading that stem of the question first, so it allows you to slow down and ensure you're answering what is even being asked here. So they're asking for a treatment here. So I tell you to run it back and see what the diagnosis is. Have they provided you with the diagnosis? Sometimes they will tell you what has been diagnosed and then you need to treat it. But if they have not provided the diagnosis, you need to run it back a step further and figure out the assessment findings so that you can come up with a diagnosis in order to treat it, right? So here we have this African American patient that came into the office for follow up, denies any complaints. Vital signs overall are good except for that blood pressure. Blood pressure is 140/92. So something definitely needs to be done about that. Patient does not currently take any medications. Labs overall look pretty good, but that potassium is low, right? Potassium's 2.3, sodium's normal, glucose is normal. So how do we want to proceed with this? So first off, you want to start thinking of how you treat hypertension, right? And so we can do our all of our first line therapies, but also for African American patients, we know thiazides, calcium channel blockers are the things that work best for this population. He doesn't have any current medical history, so we don't need to consider any kidney protective medications at this time. But also, with this, first line therapy would be a thiazide, right? But remember, you always want to monitor those electrolytes before prescribing a thiazide. This patient already has hypokalemia. Thiazides can cause hypokalemia. So we don't want to go with a thiazide right now. So we would go with the calcium channel blocker, okay? So C, amlodipine would be the best answer choice for this patient. All right, question number 2. The nurse practitioner and NP student are discussing starting their patient on hypertensive management. The patient has a history of COPD, diabetes, and seasonal allergies. He has attempted lifestyle modification and continues to have uncontrolled hypertension. What is the best treatment option at this time? Is it A, chlorothalidone, B, lisinopril, C, amlodipine, or D, HCTZ? Take a moment and tell me what you got in the comments, you guys. All right, so stemming the question here states, what is the best treatment option at this time? So again, we're looking for a treatment, so let's run it back and see what the diagnosis is. They told us that this patient has uncontrolled hypertension. They are trying different things, have tried lifestyle modification. He remains uncontrolled. He has a history of COPD, diabetes, and seasonal allergies. So we know for this patient, based off his medical history, we need to give a renal protective medication, either an ACE or ARB in these situations, right? So here, the best answer choice is B, lisinopril. Let's give him an ACE inhibitor to start it off with, okay? And then lastly, question number 3 for today. The patient presents to the office for follow-up. The patient denies any complaints at this time. Vitals today are as follows. The blood pressure is 124/82. Respirations are 20. The pulse is 72 beats per minute. And the temp is 98.6 degrees. Based on these findings, what are the next best steps by the nurse practitioner? Is it A, nothing at this time? B, recommend lifestyle modifications like the DASH diet and exercise? C, amlodipine, or D, chlorothalidone? Take a moment and tell me what you got. All right, so similar question here states, based on these findings, what are the next best steps by the nurse practitioner? So what should we do next, right? What's the best thing to do next? Patient overall is doing well, doesn't have any complaints, just here for follow-up. Vitals overall look pretty good, pretty stable. But y'all, the blood pressure goal is 120/80, right? This is 124/82. So this is actually considered pre-hypertension, okay? So at this time, you want to implement lifestyle modifications because we're trying to prevent it from climbing and worsening, right? So start to implement those lifestyle modifications now, being that DASH diet, exercising 5 days a week for at least 30 minutes each of those days. Or if they're doing high intensity, they can do 75 minutes, okay, for the week, okay? So B is your best answer. All right, you guys, I just want to kind of work through some hypertension questions with you. As always, I hope you found it helpful, but make sure you like, comment, subscribe, and share with whomever you may think may find this beneficial as well. And make sure y'all meet me back here. If you need any of the resources that I offer, feel free to reach out to the nursing studio at 803-400-6864 or shoot us an email at thenursingstudio, the number 1, at gmail.com. I offer review books, either in the ebook or paperback option, and they're both linked in the bio of this channel. I also offer a self-paced review course that is designed for family and adult GERO review students preparing for ANCC as well as AANP exam. That is also linked in the bio of this channel. We also have one-on-one sessions that are broken down in 3 different tiers. You can either book sessions for your weaknesses, book an exam readiness assessment, or 3, the custom package to help you say if you've been unsuccessful so that you can work with me. I will gauge your weakness, design and structure a study plan, work alongside with you during that time, and take you from unsuccessful to successful. So you guys, if you're looking for any of those things, feel free to reach out. I look forward to working with each of you. And if you want to join us in the practice question course, that is next week on July the 13th. There are 2 spaces available. And like I said, on tomorrow, I'll be mentioning who has received the free option. Okay. All right. Make sure y'all meet me back here. Happy studying. Bye, y'all.